Welcome back to another deep dive.
Great to be here.
Today we're tackling a really fascinating topic, and honestly, it gets pretty complex: medical tourism in India.
Yeah, it's a big one.
We've been looking through some source material, mainly excerpts from a documentary transcript, actually, and our mission really is to unpack this whole phenomenon. Why are patients flying from, all over the world to get medical care in India?
Exactly. We want to get into the reasons, the kind of broader impacts it has, and crucially, what it tells us about healthcare inside India itself. It's not straightforward.
Not at all. You see folks coming from North America, Africa, the Middle East. It's quite the mix.
It really is. And the sources you've got give us a good look behind the curtain at all the different layers involved. So the big question, like you said, is just why?
Right. So let's dive straight into that. What are the sources telling us about the main reasons people are choosing India? What's the biggest pull?
Well, one thing jumps out immediately from the material.
The cost.
Yeah, the cost.
Yeah.
It's made really clear that the price tag for medical care can be just dramatically lower compared to Western countries.
We hear from this guy, Jeff Briska, an American living in Japan, right? He went to India for treatment.
That's him. And he points out, that the American system is very expensive. But in India, even factoring in his flight, the cost was very reasonable.
And it's not just him. There's a doctor quoted, Dr. Mohammed Rahan, practices in Bengaluru.
Right, trained internationally. He says you can get things done for like 110th the cost. That's huge.
And it's not only massive procedures. The sources mention Jeff's mother got major dental work done too for substantially less than back home.
And what's interesting is how the source material explains why it's cheaper. It sort of links it to the IT outsourcing boom. You've got lower labor costs, and this is key, it's high quality labor.
Ah, okay, so skilled professionals, but the overall running costs are just lower.
Pretty much. And that saving gets passed on to the patient, making the price much more attractive.
So that's the first big piece. Top-notch quality, seemingly at a much lower price point. But then you have to ask, okay, is the quality really as good?
And the sources tackle that head on. They really highlight this perception and often the reality of high standards and efficiency.
Yeah, Jeff Briska apparently compared his Indian hospital stay to ones in the US and Japan.
He did. Said it ranks equal to them and felt very efficient. He noticed that things get done quickly here, which isn't always the case elsewhere. Things can drag on.
And there's another patient, Darlington Aloma, who needed urgent care.
Yeah, life-saving stuff. He described the staff as perfect, serious over the job, very dutiful. That kind of feedback about dedicated, efficient care seems to pop up quite a bit in the material.
So cost, quality, efficiency. What else? The doctors themselves?
Absolutely. The expertise factor.
Yeah.
Jeff knew his doctor had experience overseas, including the U.S.
Right.
And Dr. Rahan, the one trained at Harvard and Cleveland Clinic, he's pretty blunt about it, says Indian doctors are on par with the West, pretty much shoulder to shoulder.
Wow, okay.
He even suggests they might have a cutting edge because they deal with Western medicine and local diseases, so they could treat the entire spectrum.
That's interesting. And the sources also mention a kind of reverse brain drain. Doctors who worked abroad coming back to India.
Yeah, that's a trend highlighted. Apparently, the better infrastructure and processes, especially in these big private hospitals, are pulling some highly skilled Indian doctors back home.
Okay, so expertise is clearly a major factor. What about just getting the treatment you need? Availability.
That's another big driver, definitely. Jeff Briska's case is a prime example. He went for an experimental bone marrow transplant for MS.
Something hard to get into trials for back home.
Exactly. He said getting into clinical trials in the U.S. was near impossible because of severe restrictions. But in India, he found more liberal acceptance criteria. Basically, he could access treatment there that he couldn't easily get elsewhere.
And for Darlington Aloma, it was even more critical, wasn't it? It was about finding life-saving care that just wasn't an option where he was from.
Right. He described himself as almost a dead human being before he got to India. So for some, it's about access to care, period. Urgent access.
And the sources touch on a couple of other practical points too, right? Advantages over other Asian destinations.
Yeah, things like strong nursing support and, really importantly, widespread fluency in English among the staff. That communication piece is vital for international patients.
Makes sense. Okay, so for the patients, the picture is pretty clear. Cost, quality, expertise, access, lots of compelling reasons. But this whole thing, it's bigger than just the individual patient journey, isn't it? These medical tourists create ripples.
Yeah, the impact spreads outwards. affects way more than just the hospitals themselves.
How so? What do the sources show there?
Well, first, there's the actual tourism aspect. It's not just about the medical procedure.
Ah, right. Jeff described India as interesting, different. Navigating it was an adventure.
Exactly. So for some, there's this element of experiencing a new place mixed in with getting treatment. It's a whole package.
And that obviously feeds into other industries. Hospitality seems like a big one.
Huge. The source material gives really concrete examples. Like, there's the Urban Hotel right behind Manipal Hospital.
They have deals with the hospital.
Yeah, formal agreements, discounts for medical tourists. The owner flat out says they're dependent on them for business.
And there was another one, Online Suites, near a different hospital.
Yep, near Narayana Rudula. Same story. The owner there says they rely on that patient traffic, they're dependent on them. They even run a free shuttle, apparently doing about 60 miles every day, just back and forth between the hotel and the hospital.
Wow. That really shows how linked these businesses are.
Totally. The sources say these medical tourists have pushed hotels to offer better facilities, and it's boosted their income significantly.
It sounds like it creates a whole ecosystem around the hospitals.
That's exactly the phrase used in the source, almost a
Yeah.
big small township. You've got grocery stores, taxis, petrol stations. They all benefit from this concentration of activity.
And this isn't just happening organically, is it? The government's involved.
Oh yeah, actively encouraging it.
Yeah.
The sources point to the 2002 National Health Policy. It strongly encourages medical tourism with things like tax breaks and cheap land for hospitals.
And they made visas easier, too.
Yeah, a special medical visa lets the patient plus 2 family members stay for up to a year. So it's definitely a strategic push to use that private healthcare strength for economic benefit.
Okay, so that's the positive spin, maybe. The growth, the economic boost.
It's certainly one side of the story. But the source material very quickly pivots to the complexities, the challenges, and some pretty stark contrasts within India itself.
Right, and this is where, like you said, it gets complex and based on the sources, maybe a bit sobering. One huge issue that comes up is data, or rather, the lack of it.
Yeah, this is critical. The sources are quite clear. Private hospitals have never released any data to actually prove the economic benefits they claim. And they're not duty-bound to share that info either.
So nobody really knows for sure how much money is coming in or even how many patients.
Apparently not. Even government ministers, according to the sources, have admitted in Parliament they don't know how many people entered through medical visas or the total foreign exchange earned.
And the source points out that without that data,
It's impossible to verify anything. Proponents can make claims, opponents can make claims, but you can't check the numbers. Are we talking thousands of patients or tens of thousands? No way to know for sure.
that lack of transparency is striking, especially when you contrast it with what the sources describe about India's public healthcare system.
Oh, absolutely. There's a description of Osmania General Public Hospital in Hyderabad.
And it sounds grim, appalling, neglect, disarray.
Yeah, limited resources, overcrowding, shortages of basic supplies and drugs. The sources say the staff do their best, but the whole system is portrayed as being in bad shape. Chronic corruption and underfunding are mentioned as big reasons why.
So you have this massive divide emerging from the sources.
Exactly. It's framed as this globalized versus marginalized split. You've got the elite, both Indian and international, accessing top-tier private care, and then the vast majority of Indians relying on this struggling public system.
And medical tourism is seen as, what, a symptom of that?
A manifestation is the word used. It highlights this reality. Strong private hospitals flourishing while the public system lags behind.
And one direct consequence mentioned is brain drain, right? Doctors leaving public hospitals.
Yeah. The success, the better pay, the better facilities in the private sector naturally pull the best doctors away from the public system. This leads to chronic shortages of staff and infrastructure right where they're needed most by the local population.
The sources also include doctors who see the problem in the public system but point fingers elsewhere.
Right. They agree it's weak, but they blame government inaction. One doctor talks about being on committees where nothing comes of it. There's this cynical line mentioned, you pay peanuts, you get monkeys, about government health jobs.
Wow. And there was an anecdote about the private sector offering help.
Yeah, offering to help improve maternal mortality in a district. But the government apparently didn't even respond for months. It paints a picture of bureaucratic inertia, maybe.
And there's even a perspective from doctors outside India looking in.
Yes, from Western countries, like Eric Kasiski, a family doctor in Vancouver. He raises the concern that medical tourists use up resources, staff time, beds, equipment.
resources that could potentially go to locals who lack access.
That's the concern he voices, that it conceivably could be helping those who don't have access to the system otherwise within India itself.
So it's this real tension. You've got the economic arguments and the high standards attracting patients, but at the same time, these deep issues with the public system, the data gaps, and these resource questions.
It's a very tangled web.
It really sounds like it.
Yeah.
Is there any sense from the sources about how these two systems, the thriving private one fueled by tourism and the struggling public one, can actually function side by side? Or is it just inherently conflicting?
Well, there are different perspectives on that in the material. You hear from the private sector side, like the CEO of Manipal Hospital.
What's his take?
He argues that the overseas patients are from a completely different income segment. They can afford to pay, so they aren't actually taking anything away from the domestic poor who rely on the public system anyway. His view is, essentially, both can coexist.
Okay, so that's one viewpoint. Does the source material offer any examples where that kind of coexistence or maybe even synergy is actually happening?
It does highlight one specific place, the L.V. Prasad Eye Institute in Hyderabad.
Ah, right. That's presented very positively.
Yeah, as a shining example. It's run as a nonprofit. It attracts paying foreign patients. There's mention of a Nigerian family, for instance.
But the key difference is what they do with the money.
Exactly. They use the revenue from those paying international patients to provide free or subsidized care to the local poor. The source says over half the treatment they provide is actually free.
So that model directly tackles the equity issue. It uses the global market success to fund local care.
Precisely. But, and this is a big but, the source points out, L.V. Prasad is an exception. Most private hospitals in India, it states, are for-profit. So while it shows it can be done, it's not the standard model.
Got it. So looking forward, what's the general feeling in the sources? Is this medical tourism trend expected to continue growing?
The sense is definitely that the market is seen as hugely growing with high potential. It's not slowing down.
And what about acceptance from the West? Are doctors like Eric Kesky resigned to it, or?
There seems to be a growing acceptance of the reality. Kesky himself acknowledges the world is becoming flat, with very few barriers anymore.
So more collaboration across borders is inevitable.
That's the feeling. He says doctors need to be ready to work with a surgeon in Mumbai just like they would one in Vancouver. It's becoming part of the global healthcare landscape.
Okay, so let's try and sort of pull this all together. This deep dive into the source material really shows a complex picture.
Definitely nuanced.
On one side, you've got these really clear, powerful drivers pulling patients towards India's private hospitals. There's the cost factor, which is huge, enabled by those labor dynamics. There's the quality, the efficiency, the expert doctors.
Doctors drawn back by better infrastructure.
Yep.
Yeah. And just the availability of treatments that might be hard to get elsewhere.
Right, and this whole thing fuels economic activity, hotels, transport, the works, and it's even got government backing through policy.
But then you flip the coin, and the sources highlight this major issue of missing data. Nobody can truly pin down the scale of the economic benefits.
And maybe more importantly, it throws that stark divide within India's own healthcare into sharp relief. This booming global private sector right alongside a public system that's described as struggling, underfunded, serving the vast majority.
Which leads to those problems like brain drain and the questions about whether resources used for tourists could be used domestically.
Yeah, that globalized versus marginalized tension the sources talk about. The elite and the tourists versus the millions relying on the public system.
And while some argue they can coexist, and you have these great examples like L.V. Prasad showing how international money can fund local care.
The sources remind us that's the exception, not the rule. Most places are for-profit, and those deep-seated problems in the public system, often blamed on government inaction, they don't just disappear.
No. They persist. It's this complex mix of global money, private enterprise, and really significant domestic healthcare challenges.
So thinking about all this flow of patients, of doctors across borders, and the divides it highlights within countries like India, it really makes you wonder, doesn't it? What does this deep dive tell you about where healthcare access and maybe healthcare equity is heading globally?
That's definitely something to chew on after looking through these